So, did you know the sex of the baby during your pregnancy? If so, what is it? If not, why did you decide to keep it a surprise?
No, we definitely learned. As soon as we could, the first ultrasound I wanted to know, and she was clearly a girl. And then all subsequent ultrasounds, all like 20 of them, literally. She was still a girl. I asked every time. She was still a girl. She's a girl.
Was this your first child? If so, was it like what you thought it would be? If not, was it anything like your past pregnancies?
Yep, first pregnancy, first child. I guess it was what I expected. I mean, no two pregnancies are the same. Even subsequent pregnancies of the same mom aren't the same. So I knew what the range could be, and it was relatively normal, I guess.
What were some major changes you noticed in your body transitioning from your second to third trimester?
It's not what I did notice, what I didn't notice. I didn't get as big as I thought that I would. The way Anna was laying, I was long, I mean, she was like longer than she like popped out. From behind, I never looked like I was pregnant. You wouldn't have been able to tell. Even from the beginning, throughout my third trimester, I didn't get huge. I mean, other than that, normal differences, you know, obviously change in boobs, change in weight. You know, I had a lot of indigestion, heartburn. That was awful.
Did you have an increased difficulty sleeping? What were some things you did to get comfortable?
I've always been a stomach sleeper, and I was lucky because she never got huge, so I could prop myself in such a way that I could still sleep on my stomach up until right before I delivered, as long as I was, you know, careful. And so no, not too much. I mean, the indigestion was really more of a factor because that tends to be exacerbated when you're laying down.
Did you have to get up and go to the bathroom a lot?
I really didn't. She was good to me. She didn't kick me overly too much. She wasn't laying on my bladder. Just not a big deal.
Were there any complications with your pregnancy?
Lots. The first 7 months were pretty normal. I didn't really have any morning sickness, just minimally. If I didn't eat often enough, all of a sudden it would hit me, wow, I haven't eaten in a while, I'm nauseous, and as long as I ate something relatively quickly, I was fine. But at 7 months, they diagnosed me with gestational diabetes, and it just went downhill from there. And my blood pressure had been creeping up. It was like borderline high, and then after the diagnosis, it just like went through the ceiling. So I was diagnosed with preeclampsia also. The gestational diabetes, we tried to keep it in check with my diet, and then they ended up having me go on an oral insulin thing, glucose thing, something. But the preeclampsia got pretty bad, and I ended up delivering early, which I think we get to in a little while.
Michelle, can you tell them a little bit about preeclampsia? I'm sure you read up.
Yeah, I did. It's the only way to resolve preeclampsia is to deliver. So basically, if you're diagnosed with it, then you have it for the rest of your pregnancy. It's generally characterized by high blood pressure and swelling. Those are the two main, right?
And protein in your urine.
Oh, yeah, which I didn't have either.
That's why every time women go to the doctor, they have to be in a cup.
Yeah.
Because they're checking for protein in the urine related to edema or swelling of especially the feet and ankles. Although some of that can be normal and increased blood pressure.
Yes.
So do you want to tell them what the risks are of preeclampsia?
For mother, you could stroke. Your blood pressure can get so bad, so high and out of control that you can stroke and die. Mine, when they finally they diagnosed, I don't know, week-wise, it was probably, my blood pressure started going up around 31, 32 weeks. And, you know, they had me coming in for blood pressure checks after that. I think it was weekly. And it held steady for like 2 weeks, and then it would go up a little bit. But after the gestational diabetes diagnosis, I don't know if it was related and I was just stressed out, or if it was just the hormones in my body, whatever, my blood pressure went out of control. By the time they told me to finally, they were like, you need to go to the hospital. I was 37 and a half weeks, and my blood pressure was something like, I don't know, 180 over 110, 120, something like that. No, sorry, I lied. It was higher than that. It was definitely higher than that. But anyway, so they had me go in and decided that they were going to induce me.
Did it take your doctors a long time to diagnose you with gestational diabetes?
Actual diagnosis, no, but I knew, but I was my blood sugar wasn't crazy out of control, so they were very relaxed in treating me. Like I said, first they wanted to start with the diet. We worked on that for like, I don't know, 2 or 3 weeks, and then I was going in for fasting glucose testing, and it was still high, and they weren't happy with it. So then after like 3 weeks, I think they finally put me on, it was called glyburide, and then that managed to bring it down, and it was never a huge concern. They were just concerned with the size of my daughter, because gestational diabetes, you can have big babies.
How much did Anna weigh?
She was normal. She was 7'12", but they were saying that she was over 9 pounds based on the ultrasounds. They were way off.
How were you feeling right before you were diagnosed with gestational diabetes?
Feeling? I felt fine. I felt fine pretty much through my whole pregnancy. I didn't have any symptoms related to the gestational diabetes, any symptoms related to the preeclampsia, the blood pressure. I never had headaches. I never was nauseous, dizzy. The swelling that I had, based on my high blood pressure, actually was pretty minimal. I really didn't have a ton of swelling. Like some women's, I mean, their faces are just completely fluid filled, their ankles, wrists, joints, and I had minimal swelling.
Did you do anything differently besides the medications and diet?
I got pulled out of work at 7.5 months, and that was awful. It was awful. I was a restaurant manager. I was working 50+ hours a week, all shifts, because the restaurant I worked for was 24 hours. So my doctor finally said when my blood pressure wasn't going, you need to stop. You need to come out of work. He didn't actually put me on bed rest, but you know, minimal movement around the house, just sitting around doing nothing. It was awful because the baby wasn't there yet. So I literally had nothing to do all day. So to go from being uber active and busy to sitting around was just mentally horrific.
What concerns did you have before you knew more about the gestational diabetes?
Concerns did I have? Nah, none. I mean, I'm pretty well versed. I like to read. I like to research. I looked into all this stuff. I knew what the possible outcomes were, both good, bad, middle of the road, and I wasn't overly concerned. Like, I had a lot of confidence in my doctors, and they took really good care of me. They saw me often, really often.
How much did your doctor's visits increase?
After the gestational diabetes, I don't know that they really increased, but once I hit 34 weeks, I think it was, they had me going twice a week. I had to go for weekly stress tests, and then weekly ultrasound, and then a second time was for just like, I don't know, monitoring, just seeing how I was doing. But it was horrible because a stress test, I mean, they have you sitting in a room in a chair, hooked up to a monitor, and for like a half an hour, 45 minutes, depending on if the baby cooperates. Because if the baby's not moving around and is not cooperating, they're not getting anything off the monitor, so then you have to sit there longer. And Anna did that to me often.
Did they actually provoke the stress test with medication with oxytocin?
No, no.
Did you have to visit multiple doctors?
No, I mean, no. My doctor's office was like, everything was there. I did the stress test there. Obviously the blood pressure monitoring was there, all the regular tests. Once they admitted me to the hospital, they did have me see a neonatal specialist, I don't know, somebody, for a second opinion to see how Anna's lungs were, if she was ready to be delivered. But
what did you do to prepare for your child's birth?
I mean, we had her room ready. I'm really practical, like I'm overly practical sometimes, and we didn't do the whole nursery thing. I'm not one to spend hundreds or thousands of dollars like preparing a room for a baby that's going to be there, for until she's 2 or 3, and then we have to change the whole theme again. I don't do all that. But I mean, the room was ready. You know, financially we were ready. I knew that I didn't want to go back to restaurant management once I delivered, so we were ready for that. I actually lined up another job. I was a nanny, so I started nannying just after she was born.
What type of delivery method did you do?
Vaginal with lots of drugs. That was my plan from the beginning. I personally don't feel like, for me, the experience could have been enhanced if I had felt everything. No, no thank you, give me drugs. I actually had to have 2 epidurals because the first one didn't take properly, wore off, I don't know what it was. But I was crying, and the anesthesiologist came in and she was like, honey, you shouldn't be feeling any of this. Well, I am, so fix it. And so they gave me a second epidural, which I don't know if it's just my body, but I metabolized it so quickly. Like right after I delivered, they said, okay, well in a little bit you should be able to lift both of your legs off the bed. I said, what, like this? And they're like, how are you doing that? I said, I don't know, but you know, it was, yeah, drugs.
Can you tell them what an epidural feels like? Because probably most people haven't had an epidural.
I don't really remember. I mean, I remember, you know, you have to bend over, scrunch down, you can't move. They inject you in, well, they put a catheter into your spinal cord, into the space or whatever. Pinched, I think there was a little bit of burning. The worst pain that I had associated with my entire thing was having the IV in my hand inserted and then having it taken out. That was the worst for me. But the epidural, it wasn't bad for me.
No, I mean, what did you feel like after the epidural? I mean, what's the sensation of an epidural?
Like,
I mean, did you have feeling? Could you move?
Oh, yeah, I could, but that was because the first epidural, like I said, it didn't do exactly what it was supposed to do. Either she missed the space or the dosing was, I don't know. But I mean, it took the edge off of my contractions, but I felt them, which was not in the plans. The second one, you know, same thing. Actually, I don't remember which side. One side of my body was completely numb, and the other side I could feel, but it was dulled, which is pretty typical, I come to find out after the fact. So.
When your child was born, did she have any complications?
Yeah. Initially, well, right off the bat, no. About 12 hours after I delivered, she was taken, a nurse came in and said, oh, I'm going to take her to have her blood sugar checked because I had gestational diabetes. She could have, because hers was at such a high level throughout the pregnancy because of the diabetes, they were afraid that hers would bottom out. So they took her to check her blood sugar, and I was like comatose. I was in labor for 24 hours. Before that, I was in the hospital for 2.5 days, 3 days, something like that. Because of all the complications, and they wanted to, I had testing done, whatever. So they took her away, and like 2 hours later, I woke up and she wasn't back. And the nurse had said, oh, you know, we'll bring her right back. 2 hours later, I wake up and she's not back. And my ex-husband, now my husband at the time, was in the other bed, and I was like, Kat, wake up, quick, go find our daughter. She's not, where is she? So he comes back and he's like, oh, the nurse said she'll be in a minute. Okay, that's never a really good thing. So they had admitted her to the NICU because, not because of her blood sugar, that was fine, but because she wasn't oxygenating, because her lungs weren't completely developed. Well, they were, but they weren't 100% ready. So her blood ox levels were in the, they were like 88, 89 when they took her in. And then they got that up, and her lungs were fine, they matured and everything. And then 3 days later, they said, okay, you know, she's probably gonna go home tomorrow. I'm like, oh, awesome, great. That night, or that late afternoon, evening, I was feeding her in the NICU, and I was looking at her, I'm like, I called the nurse over, I said, does she look yellow to you? So sure enough, she was jaundiced. She ended up in the NICU for another, I don't know, 3 or 4 days under the billy lights because of the jaundice. But long term, no issues.
How many weeks was she? How many weeks gestation?
She was 38.
38.
When I delivered, yes.